let's talk about getting ready for your clinical. In PT school, there can be a lot of different clinicals that you might end up going to. So usually there's about 3 clinicals, but you get a lot of choices as to where you want to get that experience at. So my previous clinical was outpatient physical therapy. And if you want to learn more about that, you can check out a video up here, maybe up here, I don't know, we'll see. And then the next clinical that I'm actually going for is going to be acute inpatient rehab. I have to sort of figure out, well, what am I going to wear? Where is this, setting? Just all these questions that I have and that I'm sure you probably do as well. So really just figuring out where are you being placed? Are you in an outpatient setting or are you in an inpatient setting? Just sort of figuring out where you're going. And then the next step would be to figure out what are the tools that you need to bring along. So you might not need to bring along any tools. Generally, it is recommended that you would potentially bring your gait belt along, as that is, the epitome of being a physical therapist. Always have your gait belt on your patient. But just seeing if there are, tools in your toolkit that you need to bring with you when you're going to your clinical setting. And then the next thing is figuring out the dress code. So if you're working in a pediatric setting, let's say, you're gonna be spending a lot of time on the floor with the children. You probably wanna choose clothing that is really easy to move around in. You also wanna, choose clothing that it's gonna wear well after many, many washings, of course, as you're gonna be just touching a lot of toys, touching a lot of kids, and maybe you want something that has a lot of pull to it, right? Something that's like really flexible, because if a child's gonna pull on your clothing, you don't want it to just like rip at the seams. So being very mindful as to what setting you're going into and then the type of clothing that you're gonna need to bring for that setting. For an inpatient setting, most likely you're gonna be using scrubs. The thing with scrubs is that, they're amazing, they're comfortable all day, but you have to make sure that to not buy, just any colored scrubs. That might be something that you need to check with your clinical instructor or your clinical site to make sure whatever, color that they usually use is the one that you're gonna end up buying. So it might be that, the entire rehab team is in a specific color, or, just because of the way that the hospital is run, or whatever the hospital is, maybe they use a specific color for all of their healthcare workers. So, don't buy your scrubs until you've gone to the hospital, or, you've asked your clinical instructors or the clinical site as to what colors they use. You should also know, what kind of way do you want to dress in an outpatient setting? So in an outpatient setting, majority of the time what I was wearing were, long sleeve tops. I didn't ever really want to wear like a short sleeve top, just because there's so much movement that's happening in an outpatient setting, checking range of motion, and like my arm's always up, and I don't want to be bothered, to shave like every single day. So I pretty much chose sleeves that were, long sleeve shirts, and then essentially just pants at the bottom. And then I realized later on, as I was continuing outpatient physical therapy, was that some of my pants were like, tight on me, and I was like, oh man, it's harder to bend down with these pants. I want something that's more flexible. So really sort of having a good grasp on, what setting you're going into, and then what are the different types of clothing you might need for that setting is a good idea to start. The next thing you want to figure out is, what is the housing situation going to look like for you? Majority of the time, Airbnbs might be the perfect way to go, just because they are, you can really choose which days you want to stay. And for some Airbnbs, when you book for maybe a month or longer than a month, they actually give you a monthly discount that can actually bring down the cost significantly. And so these are some things that you want to consider. Are you gonna stay in a room rental that's, maybe you're going to a college town and you can find some, housemates or roommates to live with? Or are you going into a town that, you don't really know anyone at? And so that's when maybe an Airbnb would be a better option. Personally, for myself, in the last clinicals that I went to, I used Airbnb, and that worked out really well for me. I did choose a place that had good ratings, and I spoke to the owner prior to, and it was a good experience. So, do your diligent work in figuring out if that place is going to be the right place for you, because it's important. You're gonna, you need a good night's rest to work the next day, and so you want to make sure that the place that you're living at is able to provide that for you. So then, going along the same lines, we also want to think about how far away are you living from the site. Is it 30 minutes from the freeway, or is it 30 minutes using the back roads? Like, where in terms of your rental is your clinic, just so that you can have a good understanding of what your schedule, is going to look like. What is your day-to-day going to look like? It can be difficult to drive, very, very long distances. Like I said, I had a previous rental for my last clinic, but I knew a lot of students who, were actually driving instead, and they were doing a 1.5 hour to a 2 hour commute every day. And, they were exhausted at the end of their day, and they were exhausted by the end of the week. And they were super, happy to get done with their clinical, because now they no longer had to make that incredible, really long commute. And so if you're not a person who enjoys driving, this is actually something you really want to be considerate about, as to how far away is your clinic going to be from where you're currently living. And, if that means you have to sublet your room for the time that you are away, then so be it. Or maybe you have to pull out more loans because now the clinic is in a different location and you cannot find anyone to actually take over your room while you're gone. So there's a lot of finances to be considered. And so there's also a lot of just figuring out, what kind of a person are you? Are you okay with driving long distances? Are you not? So having a good understanding of these things is going to be really, really helpful. Going to a new place can be a lot of fun, and but it's still a lot of work. So don't forget to take your notes with you. Take your iPad, take your paper notes, bring your laptop. They might want you to document using your personal laptop. They might have one for you at the clinic. Whatever the case might be, you just want to make sure that you're coming in prepared with your notes that you have. Your clinical instructor may have a different way of doing things than you do, and they might have a little bit of different information than you do. And so when those occasions those situations arise, you want to be able to see, okay, let me go back to my notes and look at what I have been taught, and then let's compare it to what you know. The notes can be really helpful in that situation, or it can be the opposite, right? You've just seen a patient, you remember learning something about it in school, but you don't remember it quite as well. You want to make sure that you come home and you're able to access your notes and study for the next day, because you're going to see the patient in a couple days after that. So it's really, really important to bring your notes with you. And it's also very important to kind of continue to review throughout your clinical. That way you kind of always know what's going on with what patient, and you have, a really good learning experience. Some places might provide a student ID, and then other places might not provide a student ID. It might be a good idea to just bring one along with you, the one that you have for your school. Usually on your school IDs, it very clearly says student physical therapist, and so you want to introduce yourself as such when you're in clinic. So it's a good idea to sort of bring that ID along and wear it. That way everyone knows that, okay, are you licensed? Are you a student? Where are you in your learning? And it can be a great way to sort of have your name being displayed. Not everyone's going to remember your name, especially when you're a newcomer into a clinic. So take your ID badge with you. Maybe they might let you use it, or they might create a new one for you, or you might end up never really using it, but it's a good idea to have it with you. Another thing is to figure out the days and the hours that you're going to be working. For example, in my outpatient clinic, I worked 4 days and I had 3 days off, but they were not Friday, Saturday, Sunday. The days that I had off were Wednesday, Saturday, Sunday. And so it's really important to figure out, what are the days that you have off? What are the days that you are working? Of course, having more days off in a week also means that your work hours will increase. So my Mondays and Tuesdays, Thursdays, and Fridays were 10-hour days instead of the usual 8-hour day in a work week. You want to have a good understanding of what your hours are and what days you're working, because you want to make time for exploring. You want to make time for the meals that you want to have. You want to make time for when you're going to study. So there's a lot of things that you still have in your life that are going to be happening outside of the clinical experience. So you want to make sure that you are able to make time for the things that matter to you. And so ask your clinical instructor, ask your clinical site the days and the times that you're going to be working throughout your clinical experience. Maybe you're getting to go to a brand new place for your clinical, which is so exciting for you. So one of the things that you can do is go onto Google and just say things to do near blah, 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 blah. So wherever you're going, just explore and figure out, what the scene is like. See if you want to work there in the future. Do some exploring, have some fun, be prepared for your clinical, study a little here and there. Good luck to everyone going on their clinicals, and thank you so much for watching this video. If you like physical therapy content, like and subscribe. Thank you.